Hi everyone, my name is Dana Ushakova-Smolensky, and today I will be presenting the implementation of electronic health records in one of the urban hospitals. It's a Fort Lee hospital, and it has 300 beds. And the after the careful reviewing of all the complaints and issues that the hospital has, I wanted to address those complaints by implementing electronic health records. The overview of the medical center, we currently have 1.5 million patients in volume, and our budget is $2.25 billion. And payers, the breakdown of the payers are 33% of Medicare patients, 33% of private insurances, and 33% self-pay, and just 1% contingent pay. The implementing an EHR is a significant task, but is necessary to address the current complaints that are made by our patients. The complaints are due to paper records. Patients do not have access to their medical records, and they also, one of the complaints is that there are errors made, and there are duplicate tests rendered due to insufficient records. Also, patients complaining that doctors and nurses do not provide them with the follow-up visits, and readmissions to the hospitals are very high. Another complaint is the communication. There is no communication among clinicians as well as among departments. So the quality of care is definitely not at the level where we want our hospital to be. The factors that made me to choose the implementation of EHR is that our facility can gain a greater functionality, it can improve efficiency, it can enhance service delivery, we can reduce the cost and also reduce errors. So the way we can justify the cost of EHR implementation in our facility is to do the cost-benefit analysis that will provide our financial planning in the way of that we will capture a variety of costs and benefits and that will arise during the process, and we can examine them closer. So after we made a cost-benefit analysis, it will help us drastically with the decision making, and it will give us a better plan whether the total benefits of our project and strategy exceeds its costs. Forecasting of return of investment is a calculation of the most financial gains or benefits that we can expect from our project, the costs for implementing the EHR, and then we can perform the total cost analysis. That the direct costs for an EHR system include the purchase price, additional software, hardware, resources needed for operations of the system, the materials, labor required for system implementation. The total cost analysis is subject to variance based on which EHR we will implement. For example, there is two kinds that on the market right now, which is a cloud or on premises. And we have to evaluate the benefits of each one and see which one will be cost efficient for our facility. I believe that the cloud EHR will be more efficient for our organization due to we don't have to invest in additional hardware, or we don't have to spend more money on the maintenance, and overall we can save on operational costs. And the implementation cost, as per Green, can range from 162,000 for implementation, and it goes up. It depends on how many departments the hospital has and how many users will be using the electronic health record system. Also, there is a fee that the electronic health record will charge per user, and according to Green again, it can average of $85,000 for maintenance. Overall, our company has the budget for implementation and the maintenance, and after evaluating the benefits that we will gain after the implementation of electronic health records, one of the benefits is we will provide a quick and secure access to our patients to their records so they can better manage their health. We also drastically can reduce the errors by eliminating unnecessary tests or duplicate tests or any other errors that can be made with the regular paper records, as well as we will better monitor our patients for follow-ups, so the readmissions to the hospitals will be less and the health outcomes of our patients will be better. And also, the electronic health record can enhance the communication among clinicians and departments, as well as better collaboration. They can access and communicate patients' medical records to better treat them. And overall, the quality of patient care will be better. The challenges that we may face during the implementation is training staff, and also the workflow can be slower due to training, as well as staff resistance because they're used to previous software, but after they're going to be familiar with the new EHR system, and they're going to see that it will basically save them time, and the resistance will drastically go down. Also, data migration can be an issue, and some of the cost of implementation, because you're not really sure what's the final cost will be, because there can be certain obstacles that I mentioned before. What are the incentives? So we're going to gain more accurate and secure accessible medical records. We're going to enhance community communication among physicians. We're also going to reduce unnecessary tests. We're going to put our hospital in better financial and operational outcomes. And of course, the goal is to increase quality of care. The Thank you so much for listening for my presentation, and I hope you liked it. Have a great one.